Hello, my name is Sarah Zwingman, and I am from San Jose, California. And I was diagnosed with cholangiocarcinoma in October of 2021. Although it's been this uncertainty and suspicion for several years. I also have PSC, which was diagnosed in 2017. And during that first year of diagnosis of PSC, I spent 14 hospitalizations with chronic cholangitis and a lot of ERCPs, a lot of brushings done, a lot of dilation of the bile ducts. And in February of 2018, some of those brushings came back suspicious. So they went on to perform a fish study, which was also suspicious. So my medical team from California sent me to the Mayo Clinic in Rochester, Minnesota. And the team there explained to us that cholangiocarcinoma, especially in the presence of PSC, is an extremely difficult diagnosis. I did not have elevated tumor markers. I had no mass or lesion. And so in the absence of that, they could not confirm the diagnosis, but they have continued to monitor me for the last 3 years, every 3 to 6 months. And sure enough, in October is when the cytology came back positive for cholangiocarcinoma. So they sent me back to the Mayo Clinic. This time I am at the Mayo in Phoenix, Arizona. And they did confirm the diagnosis. I have a 1.4 centimeter mass in the common bile duct. So I was accepted into the Mayo protocol for cholangiocarcinoma. I underwent 4 weeks of twice daily radiation. And at the same time, I was taking oral chemotherapy medication. The next step, I will have staging surgery to make sure that the cancer is not spread. And then I will go on to liver transplant. It's been an extremely hard process because I've been carrying this burden of uncertainty for 3.5 years, knowing that there's suspicious cells in there, but they're not sure if there's cancer. They're not sure when we're going to start treatment, if we're going to start treatment. So the emotional roller coaster is quite intense, but I have a lot of support from, my family, my friends, my church. I also have met a lot of amazing people through PSC Partners Seeking a Cure, and actually have a couple of people I know have met personally that have gone through the protocol. And so that has been super helpful. So I'm glad radiation is done. I'm feeling great about that. I'm definitely anxious to get my transplant. But I really hope that, new development can be made to help with the diagnosis and early detection of cholangiocarcinoma, so other patients don't have to go through all this uncertainty and just kind of crazy journey that I have gone through. Thank you so much.